Thank you. Thank you, Regresa, for wonderful sharing knowledge about the anemia and diabetes. And now I will invite Dr. Rajesh Kumar Sharma for his lecture. That he is a BSc, BHMS, MBBS, MD in homeopathy and ADI London. And he is a privileged and executive member of Delhi Homeopathic Medical Association, life member of Homeopathic Medical Association of India, life member Indian Institute of Homeopathic Physicians, and life member of Indian Medicolegal and Ethics Association. And he is a faculty to several national and international conferences and recipient of many international and national awards. He is the executive editor of Himalayan Homeopathic Sandesh and chief managing director of Homeopure and Research Institute, Vaibhav Homeopathic Pharma and Spurs Multi-Speciality Hospital. So please continue, sir.
Thank you, everybody. Thank you, KHA Study Group. Congratulations on your second international conference. Let me share. Can you allow the screen sharing, please?
You should be able to share, Dr. Rajesh. Please can you try once? It shows like focus. We are already focused. Maybe is there okay? There is one more. Okay. Yes, now we should.
Yeah. Can you hear me?
Yes.
Okay. Let me start because the time is short. Already my time from my slot has been consumed. Therefore, I will cut off some of the screens. Today's topic is medico-legal issues in homeopathy, especially in India. I will talk about the global issues also, but especially that is dedicated to Indian medico-legal issues as pertaining to homeopathy. To explore medico-legal challenges in homeopathy, we have to learn a lot regarding medico-legal issues. We should know what is written inside the IPC or the Bharatiya Nyaya Sanhita of India. We should learn about the medico-legal issues also. Why understanding of the medico-legal aspects is crucial for homeopathic practitioner, I will be discussing this. Let us see the overview of homeopathy in India. National Institute of Homeopathy was established on 10th December 1975 in West Bengal in Kolkata city as an autonomous organization. It was under the Ministry of Health and Family Welfare, Government of India, and since then homeopathy is growing too fast in India as well as in whole world, but especially in India, it is growing too fast. The current status of homeopathy in India is the National Commission of Homeopathy is regulating under the Ministry of Ayush the entire education as well as the practice of homeopathy in pan-India country. As far as statistical data is concerned, that is dedicated to 22nd May 2024, there are over 3 lakhs, approximately 3 lakhs registered homeopathic doctors inside India, and we have a growth of approximately 12,000 homeopaths adding per year. That is a very wonderful growth, and we are proud of that particular homeopathy growth in India. As far as regarding the homeopathy market size worldwide in 2024 to 2028, the homeopathy product market forecast is the homeopathy product market size will be increased by billion at the rate of approximately 11% between 23 and 28. Our market research and growth report examines historical data from 18 to 22 besides analyzing the current market scenario. This is a very brilliant growth of homeopathy globally. In India, Central Council Act 1973 and Drug and Cosmetic Act 1940 are majorly governing the homeopathy practice inside India. Formerly CCH was there, Central Council of Homeopathy, but now National Commission for Homeopathy is governing the homeopathy practice inside the India. There are certain type of practices which are permitted to homeopaths, and there are certain type of practices which are prohibited to homeopaths. The permitted practices are diagnosis, treatment within the realm of homeopathy, and the prohibited practices are the surgical procedures, major surgeries, emergencies care beyond the scope. Now, I will explain the permitted procedures which can be adopted by each and every qualified homeopath in Indian continent. Homeopaths can use all the necessary measures in treating a critical patient. Whenever a patient is critical, the homeopathic physician has power to use the critical measures to save the life of that particular victim. The homeopaths are exempted from biomedical waste treatment tie-up if not running indoors. Most of the homeopathy doctors are not running indoors. The homeopaths who are not running indoor practices, they are exempted to be tied up with biomedical waste treatment facilities. There is right to give evidence in any court of law whenever needed, and which must be pertaining to homeopathy. The homeopaths can issue medical sickness certificates, medical fitness certificates, or any other certificates which are needed by the law inside India. There is right to conduct normal vaginal delivery. Most of the homeopaths do not know to conduct normal vaginal delivery, but the homeopaths can do. I will explain in further slides. These are the rulings from Central Council of Homeopathy. The duties of homeopathy practitioner to their patients. The patient must not be neglected. This is true. A practitioner of homeopathy is free to choose whom he will serve, provided he shall respond to any request for his assistance in an emergency or whenever temperate public opinion expects the service. There is act of negligence. A practitioner of homeopathy shall use any drug. This is the point. A practitioner of homeopathy shall use any drug prepared according to the rules of homeopathy and adopt other necessary measures as required. This is the schedule of homeopathy. I will repeat. A practitioner of homeopathy shall use any drug prepared according to the homeopathic principles. Okay. And he can adopt other necessary measures as required. I will explain the necessary measures. What are the necessary measures other than medicine in practicing the medical science in India? This is correction and maintenance of airways, correction and maintenance of breathing, and correction and maintenance of the circulation, fluid and electrolyte balancing, maintenance of blood pressure by IV fluids and homeopathy medicines, supplementation of oxygen and blood transfusion, and supplementation of nutrients by required route, that may be nasal, that may be IV, or that may be gastroenteric tube, etc. Minor surgeries as first aid and stoppage of bleeders prior to refer to the concerned specialist. Fixation of fractures prior to refer to concerned specialist. Conduction of normal labor and maintaining the complicated patient prior to refer to the concerned specialist. CPR, defibrillation, shock management, and use of ventilators. These are the necessary measures which are other than medicine and medical practice. I have asked for RTI, right to information. There is right to use supplementation and routine diagnostic methods in homeopathy. This is the answer from CCH. Homeopathy Kendriya Parishad. This is homeopaths can use glucose, saline, oxygen, etc. if they are trained in their education. Every homeopath has undergone 1 year of internship in the hospitals, and they have learned these, each and everything. The use of saline, use of oxygen, use of glucose, use of ventilator, they have learned. Again, there is a government order regarding exemption of homeopaths from biomedical waste treatment tie-up. This is the answer from an RTI. The homeopaths who are not running indoor hospitals or indoor clinics, they are exempted from common biomedical waste treatment facility. And but only condition is there, they have to register themselves with pollution control board only for one time. This is the one time registration with pollution control board, but there is no need for biomedical waste treatment facility. This is another example. This is another RTI. There is right to give any evidence in any court of law in India. This is the rule. Homeopath shall be entitled to sign or authenticate a medical or fitness certificate or any other certificate required by any law to the signed or authenticated by a duly qualified medical practitioner. The homeopaths can issue certificates to RTO, insurance companies, and for any type of joining of the jobs or anything. The homeopath shall be entitled to give any evidence at any inquest or any court of law as an expert under Section 45 of the Indian Evidence Act 1872 on any matter relating to homeopathy. There is right to issue any certificate required by law. This is the RTI. This is the answer in Hindi. I have already explained. There is right to conduct normal deliveries. This is again an answer from CCH towards my right to information asked. If a practitioner of homeopathy is engaged to attend to a woman during her confinement, he shall do so. This is the explanation. Refusal to do so on excuse of any other engagement shall not be considered ethical except when he is already engaged on a similar or other serious case. When a practitioner of homeopathy who has been engaged to attend on an obstetrical case is absent and another is sent for the delivery and that delivery is accomplished, the act of practitioner of homeopathy shall be entitled to his professional fee, providing he shall secure the patient's consent to withdraw on the arrival of the practitioner of homeopathy already engaged. This is self-explanatory condition. The homeopathy practitioner can do, they can conduct the normal vaginal deliveries, and for complication, they can refer to the concerned specialist further. There are certain prohibited procedures also. Most of the government officials and even the general public or patient, they think that the intravenous use of saline, supplements, blood transfusion, etc. is not the part of homeopathy. But it is not true. These can be used by homeopaths. The use of Rice tube, Polish catheter, ventilators, it is presumed not to be related to homeopathy, but these can be used by homeopaths. Minor surgical procedures like FNAC and biopsy, they can take the samples, homeopath can take the sample of like FNAC or biopsy and send for studies to the concerned pathology. Cardiac examination like ECG, TMT, these can be used by homeopathy. Echocardiography, because it needs a PCPNDT registration, which is not applicable to the homeopathy. Only ECG and TMT we can do. We can do certain pathological tests, but most of the tests are restricted. Radiological investigations we cannot do, but X-ray we can do. There are certain limitations of homeopaths. I have asked the question, can a BHMS doctor perform ultrasound scanning and pathology test along with reporting like an MBBS? The answer was no record found available in this council, hence transferred to the Medical Council of India. Medical Council of India is governing allopathic system of medicine and it will never support the Ayush system, and he will definitely deny this question. There is again a question in treating COVID-19 patients. You can see this certificate. I have got the training to treat the COVID patients, and the certificate is by the Uttarakhand Medical Homeopathy Medicine Board, the signed by Registrar of Homeopathy. The Dr. Rajni Sharma is trained Ayush homeopathy practitioner for novel coronavirus, preparedness, response, and containment. But when a homeopathy doctor treats the COVID patient, certain a number of questions arise from the mouths of the public and from the certificates of the government, whether a homeopath can treat COVID or not. They often consider a homeopathy doctor is not able to treat the COVID victim, but the government is supplying the certificate. Again, common medico-legal issues faced by homeopaths are, first of all, misdiagnosis. Most of the homeopaths, they fail to diagnose the diseases, the conditions correctly, and sometimes they have delayed diagnosis. They make delay in making the correct diagnosis. The reasons are unqualified practice, practicing without proper education or registration, and there again next medical legal issue is very high. The homeopathic advertising violations. Most of the homeopaths try to make advertisement by their newspapers, magazines, pamphlets, or their videos on social media, etc. This is prohibited by law. I can quote a case. This is from Malda. Malda is from West Bengal. There was a doctor who was treating a sebaceous cyst of the patient, which was present on the breast of the patient. And that sebaceous cyst accidentally, very rarely it gets converted into the cancer condition. Unfortunately, that sebaceous cyst converted into carcinoma, and the patient was suffered a lot, and the patients took the shelter of the court, District Consumer Dispute Redressal Commission of the Malda. This is the case number CC 30 2018, date of filing 31st August 2018. You can see there was cystic lesion, there was sebaceous cyst on breast that progressed into a carcinoma, and court punished the doctor. The compensation of 50,000 rupees was paid, penalized to the doctor, and for the medical pain and agony. This was due to delay in diagnosis. The homeopath failed to diagnose the condition accurately. Most of the sebaceous cysts are not carcinomatous, but very rarely they can be converted into carcinoma, and there is the need of biopsy or clinical examination, very careful clinical examination, to make the correct diagnosis in proper time. This was the failure of the homeopath. There are certain legal responsibilities of homeopathic practitioners. There is standard of care. Homeopaths have duty to act within the scope of professional competence. There is legal need of record keeping. The homeopaths must keep the proper record that is needed for at least 5 years. A medical consent is also necessary. Informed consent is legally important, especially for experimental treatments. There are certain drug regulations in homeopathy: Drug and Cosmetic Act, Quality Control, Labeling, and Sale of Over-the-Counter Act. I will discuss. There are certain bonds for homeopath. A physician of homeopathy shall not act contrary to the laws regulating the practice of homeopathy. He shall not assist others to disobey the law regulating the practice of homeopathy. He shall act in aid of enforcement of sanitary laws and regulation in the interest of public health. And the homeopath must comply with provisions of Drug and Cosmetic Act, Drug and Cosmetic Rules, the Pharmacy Act, the Narcotic Drugs and Psychotropic Substances Act, the Medical Termination of Pregnancy Act, the Transplantation of Human Organ Act, the Persons with Disability, Equal Opportunity and Full Participation Act, and Biomedical Waste Management and Handling Rules, and such other related acts. I wonder, certain acts are not applicable, entirely not applicable to the homeopaths, the narcotic drug and psychotropic drug. No homeopathy is using the medical termination of pregnancy. Homeopathy practitioners are usually not doing MTPs, and no homeopath can transplant the human organs. But why this transplantation of human organ act is applicable to the homeopaths? I wonder. There are some certain advertising guidelines. Regulatory restrictions are there. Homeopaths must know what is allowed and what constitutes a violation, and they must not do false claims and must not do unauthorized endorsements. For advertisement, a practitioner of homeopathy is only permitted formal announcements in press and about the following matters, namely, at the time of starting the practice, he can make advertisement during the change of type of practice. He can make advertisement during change of address, during temporary absence from duty, during resumptions of practice, and during succeeding to another practice. He shall further not advertise himself directly or indirectly, price list or publicity materials or manufacturing firms or traders with whom he may be connected in any capacity, nor shall he publish cases. He will not publish operations or letters of thanks from the patients in non-professional newspapers. He can publish in professional newspapers, he can publish in medical journals, but he cannot publish his acts in routine publicity matter or journal, provided it shall be permissible for him to publish his name in connection with a prospectus or a director's or a technical expert report, but a homeopath can publish his case histories, his achievements in medical journals only. There is importance of medical legal documentation. Proper documentation as a defense in medical cases, and types of documents including patient records, consent forms, and treatment plans. There is role of expert witness in homeopathy when needed in case of disputes or malpractice claims. And what is the qualification criteria for being considered an expert expert witness in court? The homeopathy is supposed to be expert witness in court whenever a matter is pertaining to homeopathy. This is the explanation I have already explained. This is the Evidence Law, Indian Evidence Act, 1872. They are legal remedies and defense strategies for practitioners, how to handle complaints and legal notices. He must know, every homeopath must know how to handle the complaints and how to handle the legal notices, how to answer them. And he must be aware of legal complications, legal counsel, importance of consulting with medical legal experts. He must not feel shy to consult a medical legal expert or lawyer for his problems. There are certain ethical considerations, balancing ethics and law, practicing within ethical boundaries. He must practice within ethical boundaries. The domain should be under ethics. Patient-centric approach should be there, putting patient welfare for above all. Patient's welfare is the above all. He is a prior approach. Certain preventive measures, risk management, regular updates or legal requirements, continuous education is needed. Staying informed about changes in the regulation, he must read and study the changes in the regulation and rules and laws. He must be associated to a certain type of medical legal association. This is my opinion. This is not a rule. Every homeopath must join a medical legal association of repute. For example, there is Indian Medical Legal and Ethics Association. I am the national homeopathy practitioner, president of that particular association, IMLIA. This is open for all esteemed doctors, all allopaths, all Ayush doctors, as well as this is open for police personals and lawyers also. There are certain rights of patients. We must know. There is right of patient to considerate and respectful care. Every patient has right to information on diagnosis, treatment, and medicine. Every patient has right to get information about professionals involved in the patient's care. There is right to expect that all the communication and records about them, about their cases, are treated as confidential. The patient's right is to keep their privacy concerning to their medical care program. There is right to expect prompt treatment in an emergency. There is right to refuse to participate in human experimentation or research or projects affecting their care or treatment. There is right to get copies of medical records. The patient can ask for the copies of medical records. There is right to know what hospital rules and regulations apply to them as a patient and the facilities obtainable to the patient. The patient's right is there to get details of the bill, and patient has right to seek a second opinion about their disease, treatment, sickness, and prognosis, etc. Now, final thoughts. The duration of study and syllabi by various government councils are the same for all bachelor level medical courses recognized by Government of India, like MBBS, BHMS, BAMS, BUMS, BSMS, except only one subject, that is pharmacology. In each system of medicine, the concerned pharmacology is taught. In allopathy, it is called pharmacology. In homeopathy, homeopathy pharmacy and materia medica. In Ayurveda, Dravya Gun Vigyanam and Nighantu. In Unani, this is Mualizar and so on. There is no difference in study regarding basic subjects like anatomy, physiology, biochemistry, pathology, forensic medicine and jurisprudence, social and preventive medicine, surgery, gynecology and ops, the pediatrics, radiology, orthopedics, practice of medicine, and so on, except their pharmacology as per respective streams. Only one subject is different in various medical courses, that is concerned pharmacology. all the subjects are same, the syllabus is very same. In reading MRI, in reading CT scan, in understanding PET scan, in understanding X-rays, ultrasounds, echocardiography, TMT, pathology, on numerous other diagnostic modalities or pathological tests, there is no role of different type of pharmacology. Pharmacology is not doing to diagnose any of these modalities. Only the supportive subjects are needed. I wonder why there are so many restrictions to the Ayush system of medicine in utilizing many of them. Why do PCPNDT, AERB, they have different modes with Ayush department? Why is the registered medical practitioner's definition always been restricted to the schedule of the MCI only? Whenever in PCPNDT you can see the registered medical practitioner is whom the person who is registered in the Medical Council of India Act schedule 2nd or 3rd. Why Medical Council of India only? This must be any Medical Council of India. The term should be replaced with any Medical Council of India. That may be Indian Medical Council, that may be Central Council of Homoeopathy, National Medical Commission, or any other. Why Medical Council of India for allopathy only? Other medical councils register their candidates in their respective schedules, certifying that he is now a registered medical practitioner. Who can see? You can see the definition of registered medical practitioner in CCH rule. The registered medical practitioner or RMP is the candidate who is registered in the schedule this of Central Council Act. And the Medical Council of India, this right, the registered medical practitioner is the candidate who is registered in that particular schedule of the Medical Council of India Act. What is the difference? All the councils are governed under the government of India. All the councils are equal. They are same. But the rules like PCPNDT, AERB, you can not do ultrasound, you cannot do pathological test, you cannot be registered at Atomic Energy Regulation Board. Why? Only the RMP registered in MCI is okay, but RMP registered in other council other than MCI, he is not okay. He is not eligible. Why? Why is there is such a non-uniformity? While there is uniformity in all the syllabus and duration of the study in all the streams, all the medical stream, the rules for them should be uniform. Why they are not uniform in India? These are the references from where I have collected the data. This is not my personal data. This is collected from this Central Council Act 1993, Dragon Cosmetic Act 1940, National Commission of Homeopathy Bill 20, Advertisement Standard Council of India, ASCI guidelines, medical legal cases in homeopathy. These are the certain references from that. Risk management and legal liability in homeopathy practice, expert testimony in homeopathy legal perspectives. These are the references. There are certain case laws and judicial decisions. A review of landmark decisions involving homeopathy practice involving insight into the judicial approach to medical legal issues in homeopathy. Supreme Court of India, various cases I have consulted. Patient safety and legal aspects of homeopathy in practice, I have consulted these references, Datta, Verma, and this comprehensive guide to patient safety. Informed consent in homeopathy, a legal requirement, Rajesh G, 18, informed consent in homeopathy practice, a legal medical. These are the references I have consulted. This is the data collected from these various sources, and I have compiled my personal views regarding the responsibilities, foundations, limits, and their scope in homeopathy practice. And that's all. I will ask all the homeopaths, they should perform all those the doctors registered with MCI are doing. A number of tasks can be done by homeopaths also if we are aware of that. Thank you very much.
We are very sorry for the delay, sir, due to the technical glitch. And thank you so much, Rajni sir, for giving such a vast knowledge about legal issues, which we homeopaths are not aware of. And this webinar will definitely help us, new as well as old homeopath practitioners, and will definitely take all the practitioner, all the precautions to avoid the legal issues. Now, thank you, sir.
Thank you very much.
Now I will invite Dr. Deepa Rajan Nimbalkar, PHMS, MD, PhD in pediatric homeopathy from Jaipur, practicing in Lifetron Healthcare Homeopathy Clinic. She is a branch head and senior doctor at Positive Homeopathy Clinic in Indranagar. Practice as a DRDO scientist hostel homeopathy clinic in Bangalore. Author of book Panchakosha Homeopathy is a Divine Science, and her articles published in a peer-reviewed journals. And she presented seminars on homeopathic management of pediatric cases at national and international platform. Received award from the Star Time Media Most Promising Homeopathy Clinic in 2019. Received the Young Researcher Award in 2021 and 23 from the Institute of Scholars. And she is recognized as a reviewer of the international publishing platform. So, welcome, Dr. Deepa.
Yeah, thank you. Thanks a lot, Dr. Mamta. Yeah,